This is a high-risk unit. We have very sick patients, and Dr. Tu is an approachable doctor. She's very knowledgeable.
Communication is key, and she speaks that language at all times. You always have to know what the right hand is doing with the left hand, and that's something that you always get from Dr. Tu.
When I first heard about the award, it was, of course, a tremendous compliment. I wasn't expecting it at all. I'm not entirely certain I deserve any of it, more so than anyone else does, but I'm glad they think so highly of me and highly of us as a team.
Anytime she sees a patient, she'll call in the nurse, call in any of the ancillary stuff that's dealing with the patient. And we meet as a group. We all come to a consensus. And even before meeting the patient, she'll actually talk to the nurse first, get feedback, go back in, come back out. And that's ultimately very, very important because the patient's always informed of what's happening throughout their whole hospital stay.
I think the collaborative approach is a newer approach. It definitely is different than the old school medicine where the doctor was, the king of the pyramid. It's more of a discussion now. Instead of just having one person making the decision for the patients, you have the doctors, you have the nurses, you have the residents, the medical students, you have the social workers, you have everybody looking after this patient sometimes at different angles and sometimes with different levels of expertise and different types of expertise. But we're looking at the whole patient in many, many ways to ensure that we're giving the patient the best care possible.
We have high-risk patients on this floor, and 1 minute they are okay, the next minute there's something wrong with the baby, there's something wrong with the mom. We need to have that communication with our doctors. You need to have that relationship that you don't feel fearful that, oh, is this doctor, I'm going to ask her a question and she might start yelling, she won't even let you finish. But we need to have that, and we have that with her. So it's important.
The nurses are integral, obviously, in taking care of our patients because they're the ones who have probably the best bond with the patients. The nurses have an hour-to-hour daily relationship with these patients, and the patients, you can tell, really trust the nurses, and they're the ones who kind of point out if there's anything normal, abnormal, or if there's anything that we should be looking at a little bit closer. So I think they play a very, very, very important role in the entire team dynamic, and that's why I'm grateful that they do their job so well and we communicate so openly.